Hi, my name's Dylan Steele. I'm an osteopath, a NEUBIE practitioner, and utilising the NEUFIT method in clinical practice. In clinic, people will often present with multiple points of pain or not knowing where their pain is coming from. Within our space, sometimes this can be referred as non-specific pain. One of the features utilising the NEUBIE is this mapping process where we place a pad on the body and then a wet pad on a carbon pad and scan through and try and locate these places of tension. This type of approach for me has been quite incredible to see what people might not actually know or quite feel within their body, but then when going through those areas, we're able to highlight these places of discomfort and then place pads in these certain regions of the body depending on where they are. For example, say the shoulder, then move through some gentle ranges of motion that the client's capable of doing to improve the range of motion and strength of that area and decrease the pain and sensation that they might be having within that place. So coupled with traditional orthopedic and neurological assessment approaches and the mapping process with the NEUBIE, we are able to gain a deeper understanding of what might be going on within my clients' bodies and their presenting complaints, and then set up some exercise rehabilitation programs utilising the NEUBIE to improve their presenting complaint and decrease the pain in that area. Another great feature within the NEUBIE is this feature called the master reset. In this process, we place some pads on the feet and at the back of the neck, and we turn the device up to a low level current that's just to a degree where the client can feel the sensation coming through their body. The use of the placement of these pads in these certain areas has been shown to increase heart rate variability. So an improved heart rate variability, or HRV score, is coupled with improved autonomic nervous system control. So take clients with stress that come in, they'll often present with, say, upper trap, neck related tension. We can use the NEUBIE and the master reset and give them 20 minutes, in a comfortable position, in a nice atmosphere, and these people were reporting less levels of stress and better sleep scores when they're tracking their sleep scores with, say, the Whoop band or an Oura ring, or sometimes even with their sport watch like a Garmin. One of the features of the NEUBIE is that we can utilize a glove that links up to the machine that emits the current through the glove. So utilizing the mapping process or even just tactile feel of locating where that trigger point might be, I can lightly touch the place of pain, turn the NEUBIE machine up to a point that's feeling slightly uncomfortable for the person, and the current from the machine can be distributed through the muscle tissue to a great level of depth, more so than traditional, say, remedial massage therapy or osteopathic soft tissue or deep tissue interventions. This has been quite good for clients with living with fibromyalgia or sports-related muscle pain, and is one of the more unique, interventions or techniques that the NEUBIE can do. Dry needling is a common intervention utilised within a lot of allied health practitioners, whether it's remedial massage, acupuncture, osteopaths, chiropractors, physiotherapists. Some of these other clinicians will use alternate current alligator clips on the needle to stimulate those needle points as well. One of the points of difference with frequency-specific microcurrent from the NEUBIE is that we get a wider distribution of current through those tissues and a deeper rate of stimulation. Also, utilising the glove that comes with the NEUBIE, we're able to focal point these points of discomfort, and it will get, again, a larger and deeper distribution of the muscle and the neurological tissue in that area that's creating a peripheral sensitization or hypervigilant state that the client might be experiencing. It's, again, some of the barriers with dry needling. Some clients aren't accustomed to having needles in their body. So this has kind of, for me as a clinician, broken that barrier where we're not having to pierce the skin with anything, but we're able to create an equal, if not better, sensation in that area. So another feature of the device, the NEUBIE device, is this foot bath or hand bath intervention where we place a carbon pad in a small bucket of water and a peripheral limb like the foot or the hand in that bucket of water and have the current come through the tissue whilst doing some simple exercises within the water. This gives a greater depth and broader sensory sensation into these areas. So people living with carpal tunnel syndrome or osteoarthritis in the hand or foot, these type of techniques have been great for those presenting complaints. Some other clients that might be living with upper extremity weakness following stroke, where they'll have their limbs held in certain contractures, we're able to place pads in the peripheral area of the muscle with their hand or foot in that area, and then just start to gently wake up that area with the foot bath technique. With the NEUBIE, we're able to manipulate the frequency of the machine depending on the presenting complaint. So whether it's pain, we can have the frequency higher, or whether it's weakness, we can have that frequency lower. So not everyone will come to the clinic in pain and they're just looking to improve their physical form. So where I work, I utilise rehabilitation techniques within a gym setting, and we can manipulate that current of the machine, lower it, and then target certain areas of the body to improve the strength in that area. Also on that topic is those living with nerve impingement or disc-related pathology that's creating weaknesses and atrophy in certain areas of the body. Again, we're able to find those points, say the calf with a low back lumbar disc bulge, and do the exercises that are specific for that muscle group, utilizing the NEUBIE and that lower level frequency to improve the strength of that area. This is also helping with pain management for those living with these type of presentations also. As a practitioner, a lot of people walk in the door with pain and limited range of motion, but when utilising the NEUBIE, the NEUFIT method and exercises for that specific area of pain, we're able to see a decreased range of motion to an improved range of motion faster than we would with just traditional physiotherapy and osteopathic rehabilitation strategies.